I think one of the big challenges right now for the general practitioners is that probably 80% of their function, and this is Vinod Khosla, who is one of the founder of some of the big technology companies in the Valley, are challenging the physician to say that several of these functions can be replaced by new tools. And I think his comments were misunderstood, say we should replace 80% of the physician, which I don't think is what he meant. But it's really that the role of the physician is going to have to change, that they're in charge of your health. They are in charge of keeping you as healthy as possible instead of fixing symptoms of a problems after you've had an acute episode. So there's a massive shift. If you think about it from a big picture point of view, is that we really built a healthcare system in the last 50 to 60 years based on the fact that people could die really fast, and that was a heart attack, an acute infection, a pneumonia. Due to a lot of drastic medical device and biotech innovations, most of these are under control. Really, the majority of what we deal with is chronic disease management, which doesn't make any sense to deal that in the emergency rooms or when you have acute symptoms. So the role of the general practitioner is going to change. It is a bit unclear who is going to take over that role. Walmart is saying, and Walgreens are saying, the pharmacists are the most trusted clinical professionals there. They are reachable. They're there where people do their shopping anyway. They should play a bigger role. So we'll see how that revolution is happening, but they're investing heavily in the space. And then as we're moving towards the majority of the physician to be now employees of large healthcare organizations, which right now it's estimated between 50 to 75% of physicians, depending on the specialties, already have sold their practice and are working for large systems there, is that their role is going to be changing. There's going to be force coordination. People are going to have to manage the person's health as well as their behaviors and their depressions, which has led to, obesity, diabetes, maybe some orthopedic problems. So there's a lot of changes there in what called patient population management, and the biggest impact is there. But it also is going to impact the specialist. So, for example, in orthopedics or selective cardiac procedures there, how do we make sure that we prepare the patient ahead of time, but more importantly, we do the rehab effectively afterwards? We all know that cardiac rehab is not effective. We need to change that. People are going to basically be measured for value. The value is not just did you do good surgery for 30 minutes or 60 minutes. It's going to be, did this patient recover fast enough? Was there a 30% readmission rate? Well, what can we do about that? The burden and the risk is going to be passed down on all the players, and that includes the physicians and then the hospital providers. And we now are going to 3 days before admission to 30 days post-discharge, and there's a lot of tools and technology that are being delivered now to enable there to be a total care management as opposed to a surgery.